Hello, dear friends. I welcome you all to this video of effects of Ramadan fasting on human body. Today, we will discuss about the effect of Ramadan fasting on immune system and its antioxidant effects in our body. So let us see about the effects of fasting on the immunity. So what is immunity? Immunity is nothing but our body resistance to the various types of infectious diseases and other diseases. So Ramadan fasting has no adverse effects on the immune function of the healthy individual. It does not, it is that there is no effect of fasting on immunity, or fasting does not lower the immunity of our body. So there is no significant change in T cells after Ramadan fasting. The number of T cells remain constant. T cells help in destruction of cancerous and infected cells. So it protects our body. There is no significant difference in the count of B lymphocytes which are involved in humoral immunity before and after Ramadan fasting. So the fasting does not affect the number of T cells as well as the B lymphocytes or B cells. Fasting could have therapeutic effects on some diseases such as immune system complications and autoimmune disorders. In fasting individuals, there is an increase of innate immunity, especially activity of natural killer cells, which are essential for antiviral and anti-cancer defense. So here the fasting has a positive effect on our immunity. It improves our innate immunity. Ramadan fasting may have a protective effect against bacterial infection. So chances of bacterial infection during fasting are very low. So fasting during Ramadan is associated with a reduction in pathogenicity of the bacteria Mycobacterium tuberculosis by increasing the numbers of macrophages. So macrophages are the types of cells which are involved in the cellular immunity. They actually kill the tuberculosis bacteria, Mycobacterium tuberculosis. So the fasting improves the number of macrophages, and that leads to reduction in the chances of infection by the Mycobacterium tuberculosis or tuberculosis. And also there is increase in the secretion of INF gamma, which helps in controlling multiple bacterial and viral infections. Now coming to HIV/AIDS, which is a human immunodeficiency virus or immunodeficiency disease. So Ramadan fasting has no negative impact on patients infected with HIV on modifying the frequency of antiretroviral therapy. So there is no significant change in CD4 cell counts, viral load, or hemocrit levels in these patients. So patients with HIV infection or those who are having the AIDS can also keep the Ramadan fasting. So Ramadan fasting actually improves the immunity of the individual. Now coming to see the effect of fasting on inflammation, or it has an anti-inflammatory effect. So increased levels of pro-inflammatory cytokines may increase the risk of inflammatory diseases, insulin resistance, cardiovascular diseases, and atherosclerosis. So these are some cytokines which can increase the chance of some of the diseases. So during Ramadan fasting, there is significant decrease in pro-inflammatory cytokines, which includes IL-1 beta, TNF alpha, IL-6, homocysteine, and C-reactive protein. So which in turn leads to the improved inflammatory status of the human body and prevention of tissue damage. So these substances actually they damage the tissue and they protect they leads to the inflammation of the various organs in the body. So the fasting reduces such type of substances, cytokines, pro-inflammatory cytokines, and these substances. So it leads to no inflammation and it prevents the tissue damage. Level of IL-6 could remain significantly low 1 month after Ramadan fasting, so which is a major anti-inflammatory, which is a major inflammatory agent, which is considered to be a long-term health benefit of Ramadan fasting. Also, reduction in levels of insulin like growth factor, IGF-1, have been noted, which is associated with neuroinflammation and age-related neurodegenerative diseases. So the Ramadan fasting also has effect over the neuroinflammation and neurodegenerative diseases. So in term, it means that they reduces the neuroinflammation and they also stop or halt the neurodegenerative diseases. Now coming to the antioxidative effect of the Ramadan fasting. So Ramadan fasting leads to increased antioxidants and reduces oxidative stress in the tissues and organs, thus reducing DNA damage and apoptosis. So these oxidative products actually leads to the tissue damage, and that may lead to damage to the DNA. So this Ramadan fasting has the effect of being increasing the antioxidants in the body. So during Ramadan fasting, there is strict calorie restriction during the day, which may further enhance the effect of fasting by preventing or delaying the onset of many diseases such as autoimmune diseases, atherosclerosis, cardiomyopathies, cancer, diabetes, renal diseases, neurodegenerative diseases, and respiratory diseases. So these are all the positive effects of the Ramadan fasting on oxidative effects in the body. So they have antioxidative effects in our body. So Ramadan does not come to change our schedules, it comes to change our hearts. So it is the effect of the Ramadan that our hearts are purified during this holy month. Ramadan is like a rare flower that blossoms once a year, and just as you have begun to smell its fragrance, it disappears for another year. Make most of it now. So it is our duty that you should utilize more and more beneficial effects of the Ramadan fasting. You should follow the Ramadan fasting, its rules and regulations, and get the benefit from it, because it comes once in a year only. So this is all about the effects of Ramadan fasting on immunity and antioxidative effects. I hope that you may like this video. I request you all to subscribe, like, and share my videos. So thank you very much.